I appreciate the invitation to speak. And so this morning I'm going to try and I don't know if there's any feedback coming through. But essentially what I'm wanting to do today is maybe hone in on where do we as bioinformatics researchers fit into this probably a very broad space of taking research to public health, which is really an implementation science. And so this is what I've been grappling with for a couple of years now is how do I take a knowledge production work that I do to a space which is really looking at how do you actually implement the work that we do. And I'm going to lean on some of the experiences I have through my role within the Africa Center for Disease Control, and then also as part of a global alliance called the Public Health Alliance for Genomic Epidemiology. And so this is really the conundrum that we sit with is how do we go from knowledge production to translating what we do in public health? And really a couple of words that is key here is how do we adopt what we do? There's lots of stuff happening here. How do we take what we do and integrate that information within the healthcare setting, but ultimately it is to improve population health. And so for us as researchers, and I think for you too, is our obsession and our focus is around taking our research projects, taking our thesis, and the end goal for us is to publish the paper, to graduate, to put our paper in a journal, to put our work into a library. But when it comes to translating that into public health, there is an additional step that is needed, and that is how do we take what we do and put it into a public health setting with the objective of improving health. And for me, this is the key dilemma that I face in driving a research agenda is ultimately what I'm wanting to achieve in public health bioinformatics is to transform a public health environment. And so key stuff when you're trying to grapple with this type of intersection is you have to address certain barriers. It is going to be very time dependent. There are certain funding that's going to direct that. And what is important is the context in which you find yourselves. And so public health is quite broad. And if you would reflect on your own research projects, can you locate what you are doing within a public health environment? And for the work that we do on pathogens, our real context is really how do what we do impact the disease outbreak phenomenon as an And so to put it another way is we are sitting in this space over here, doing research and development in the bioinformatics space. And really it is at this intersection with public health implementation that we are grappling with. And our context is essentially national public health labs. Why do we say national public health labs? Because they have the legislative power to in fact activate and respond at both a national in response to public health crises. And so our implementation that we do is really honing in on national public health labs. And so if you reflect on your own research project, whether it is a metagenomics project, whether you're generating a pipeline to analyze some or other SNPs, whether you're working in the non-communicable space, what is the ultimate goal of your work? Where is it going to eventually land? Thinking through the translational aspect of what we do becomes an important part because it will then direct a lot of what we do. And so we are often used to the idea of doing our project. There's methodology. There is certain, you'll have positive controls in your project. You'll have negative controls. And the critical value of that in the translation phase cannot be underestimated. So I mentioned this is our context. in the work that I do. And where does it go? So this is about a bit more detail, thinking through the translation. And if I take the bioinformatics in the context of translation into the value chain. And so if you were to map back work that you might be doing in pathogens, where along this value chain do you find the direct link of the work that you are doing? And I think it's important that we start thinking about where do we find the public health impact in the pathogen. And what I'm hoping to do is to go through a few examples of how we try to populate this value chain in strengthening national public health labs. And so these, if you are present in South Africa, Institute for Communicable Diseases. If you're sitting in Uganda, that would be the Central Public Health Laboratory. And so every country would have its national public health lab, national public health institute that would go by various names. And so this is really the context in which we find ourselves. And I'll come back to this slide as we move along. But just moving back a bit, looking what's happening globally, there's been a huge shift around about 2013, 2014 in national laboratories adopting next generation as part of their everyday business in disease surveillance. And so there's been a paper essentially that has reviewed this migration from routine diagnostics to adopting high-throughput sequencing as part of their delivery at the national level. And if you were to go and look at this paper, essentially what they conclude is that every national laboratory needs some type of standardization. We're talking here about there has to be a decentralization of diagnostics, and there is moving away from a very mammoth diagnostics more broadly across a region. There needs to be careful consideration for how is managed across a large geographic location in order to facilitate collaboration. And then also, when you are at the interface, you have to have community. And so when you and I develop technology, when we are wanting our technology to impact public health, we have to give careful thought to how do we in fact bring on board communities so that what we're wanting to integrate into communities is done so very much with respect and also understanding what the needs are of various people. And so if that's what's happening in Europe, what is the context in Africa? If European laboratories have done that migration back in 2014, actually, what is happening currently? And so the Africa Center for Disease Control essentially grapples with about 150 outbreaks. And so you start to understand that if we have these global crises, which, for example, COVID-19, that's one of our challenges, but certainly is not the one that is the most impactful within the continent. So I've been asked to speak into this one here. Is that better? All right. And so I think for us continentally, this is our challenge, the variety of pathogens that impact us, and it might be a local context, it might be a regional context, it might not impact globally, but this is really what we are grappling with. And so if it is the National Public Health Institute that have to respond to this, what is our relationship and our involvement in informing some of the methodologies that they utilize? Because for us at universities, we are really at the interface of R&D, and then it is getting that to your national labs so that we can respond more effectively to this range of diseases. One could also quantify the monetary impact of these diseases, and there's some nice work that's been done in really putting numbers to these pathogens and really how that actually impacts us as a continent. So in the context of what we are grappling with as a continent, back in 2019, the Africa Center for Disease Control and Prevention launched an Institute of Pathogen Genomics, essentially to mitigate some of the challenges which we're encountering on the continent. Certainly the absence of policies for countries to effectively respond to these pathogens. This, I'm sure, is no surprise to you, the limited application of genomics and bioinformatics in public health. And this notwithstanding the work that has been happening in the human genomic space, but the fact that translating that into what is clearly in the public health infectious disease space is one thing that they had to respond to. We constantly grapple with a workforce that needs to be adequately trained, and really utilizing all of that for the ultimate goal of taking a public health decision. And that is really where the impact comes in. I think this also just demonstrates that across the evolution of genomics in the continent, and certainly we see this globally as well, a lot of that capacity has really been within academic institutions. And so we start to see that the advancement and the acceleration of bioinformatics and genomics has not necessarily happened within national public health laboratories, but in fact within the academic environment. And it is how do we bridge that gap as we move forward. And so in response to that, what the Institute for Pathogen Genomics, see where I am linked to, has decided is could we then transform a national public health laboratory at a number of levels, be it at the level of establishing some policy frameworks, looking at what does a network look like that can be harnessed so that we leverage existing expertise at all the universities. Many of them are represented in this room and online. The obvious need for capacity development. What does our data responses look like? What do our infrastructure look like? And then this is really the crux of it. How do we take all of this and action it in a way that we can actually provide tangible evidence in order to effect a public health response? And that is really the crux of what happens in a public health lab. And so, having said that, in 2019, come a couple of months later, COVID-19 hit us. And so, for a new institute within the Africa Center for Disease Control and Prevention, how do you build all of this in the midst of a global crisis? How do you build all of this when lockdown actually happened? And the way that, and the approach that we have taken, and this was led by a colleague of mine, Sophonius, is really to tackle these three. Is it possible for us in the midst of a crisis to leverage existing expertise around the world? How do we continue to train people? And then how do we actually action that into an ability for a Minister of Health to say that the way for us to limit is to look at X, Y, and Z, informed by data. And so the way that was taken back in early 2020, we basically set up this structure, which is really harnessing existing expertise. And I think the one thing you're going through your career development is actually recognizing the value of partnership. And so what has been very effective during the midst of a disease outbreak has been the ability to rely on a number of expertise and leverage that as a way of democratizing certain access to and the implementation of next generation sequencing. And what this network actually facilitated was connecting about 36 countries on the continent, moving in excess of 30,000 bios, and trying to limit the amount of time to do that very much the way that and as such needing to be able to track the spread of the disease. So all of this is happening in an environment in infrastructure challenges. And so for this morning, I thought what would be useful is maybe just to give you some of the learning. Remember what I told you. How do we and translate that into public health? And part of that transition is an identifying transition. And one of it was discovered during this referral process. And this is just a mapping of what is happening on the continent, certainly back in 2021, in terms of dry ice. And so look at this one. 5 countries with local commercial supplies for liquid nitrogen, but no dry ice. So if you are transferring samples from the continent, you want to ensure the integrity of these biospecimens, you are dealing with this kind of infrastructure and supply chain. And so when we are wanting to take what you and I are doing in an academic setting into a public health setting, is to be acutely aware that there'll be certain gaps that will have to be filled if we are going to effectively take the knowledge production that you and I generate to see that translate into public health. So you and I might not be able to effect the solutions to this, but what it does say is that if we are going to make pathogen genomics a critical part of a national public health, there's certain things that's going to have to be put in place in order to facilitate that. And so really what we had back in 2022 was essentially dealing with laboratory processing, establishing the networks, developing the workforce in the midst of a crisis, dealing with some of the supply chain that I've mentioned to you, looking at some standardization and then sequencing. So all of that in place in order that when you and I develop our bioinformatics know-how, we can then integrate into a system that is going to be critical in order to measure the public health impact. And so transitioning then to data associated with specimens, I think when we talk about a public health emergency, the take home here is that whatever we do, it's important that it is happening rapidly. It must be accessible. We have to make sure that what we are doing is certainly findable, reproducible. And I think it's very important that we facilitate the high quality data so that when decision makers have to take the data that you and I produce, that there is a level of confidence that accompanies that information, which is going to have far-reaching effects. Because what you and I would be doing in terms of analysis in the midst of an outbreak has to be translated to national decision that is taken. So in ensuring that we certainly account for the reproducibility of data that we are dealing with, we really need to have some sort of mechanism that can be mobilized rapidly in order for us. And one of the ways we have tackled that was essentially to establish a global alliance, which is PHAGE, which is the Public Health Alliance for Genomic Epidemiology. And essentially this was an international group of researchers that came together and recognized the current ecosystem at the time where bioinformatics development is and was happening. We needed to bring that closer to public health in order to facilitate the easier adoption and also the implementation of what was an academic exercise. And so we set out to essentially establish an environment that could certainly focus on standards, on documenting best practices, and I think improving the availability of certain bioinformatic tools for public health. And I think with all of that is how do we ensure that the data is open, certainly our tools are, and that they are reproducible. I think I just want to make a point here. In the wet lab, we have a very clear framework around having a goal standard. PCR to what we know, and we can then validate the work that we do in the lab. In the bioinformatics space, with the rapid evolution of tools and methods, I think we can learn a lot from the epidemiology fraternity, where they believe that your primary goal is to ensure validity. What is the goal truth? What is the reference? And if you cannot guarantee validity, you then insist on reproducibility. And I think this is where we sit in bioinformatics. We probably don't necessarily know what is the gold standard for comparison to a metagenomics result. What is the one reference point that need to be used for all our pipelines that we are running? And so if we cannot ensure validity in that sense, our jobs as bioinformatics practitioners has to be to drive reproducibility in the tools that we develop, in the data that we produce. And I think that for me has been the crux in working in this space, is that our man has to be providing methodology that can feed its way into the public health environment. And so what we've done in this, this alliance is really to set up a system where we could certainly look at leading best practice implementation. A lot of that work happens within a number of working groups. And each of these working groups, you could imagine mapping that onto this value chain I showed you earlier. And a couple of examples of where this is quite critical. In the entire value chain, it is all starting with a biospecimen. And biospecimens are not only the biological material, the richness of that biospecimen hinges on the access to and the collection of metadata. And in the midst of a crisis, it's very difficult to communicate what must be collected. And so during the times of calmness and peace, as we are in the context of a disease outbreak, there needs to be an agreement as to what do we actually associate with that genetic material. And there is various levels of data that will inform biological material. And one of the projects that we have within the Phage Alliance is really, can we provide context to that biospecimen? Can we get a global agreement as to what does the field clinician collect at the point of the clinic when they are engaging with a patient? But what that data, once you marry the data, it allows you in the context of a disease outbreak, certainly to get a handle on identity of the pathogen. It gives you a handle on the evolution of the virus bacteria in response to some pressure, be it a disease or a drug. And it allows you to also to start to ask, can I pinpoint where this disease is? And with that, give some credible information to your public health official in order to do a response. And so that's what we actually did in the consortium, is really building a metadata standard or co-creating the standard with public health and providing the necessary tools in which we could engage with global repositories in order to make sure that data that gets collected can be integrated with a like or your European nucleotide archive. And so you have a number of variables that gets collected. This work has been driven by the Data Standards Working Group that is led by two of the co-chairs. These two are based in Canada. And what I'm not going to be showing you this morning is how this work is now being moved into other stuff, like cholera, like mpox, like malaria, and how do we formulate the data variables that have to accompany in the midst of an outbreak, so that when you and I get the genetic information, we have contextual information that can interpret the kind of work that we are doing. There's another working group within this consortium, which is really the generation of analytical tools and how we visualize it. And this working group is led by three of our colleagues, as you see in front here. And really the question that this work is, how do we take the analytics and in the minds of public health officials that when they the tools that you and I build as part of our student projects, as part of our research projects, that people can rely on the output of those tools. And so this is taken beyond just doing the project for the sake of degree, but it is saying, do the tools we build include mechanisms of verifying what we have produced, of validating what we have produced, ensuring the authenticity of the data that has come out. And one of the outputs from this working group, and I just pointed to one of them, is really asking, could we provide a guidance to public health that if you're going to use bioinformatics in the public health and develop your pipeline, there are certain principles that you have to follow. And I think this is really the key in the work. How do we strengthen a national public health plan, where unfortunately the key responsibility of driving a national agenda to respond to public health? And so this is the kind of work that we're doing in that space. But what it does is it allows us to fill this value chain. It allows us to move from a laboratory preparation of material to guaranteeing with some level of certainty the validity of the data that comes out. And this takes you back to my slide that I had at the beginning. As public health bioinformatics in the pathogen space, we are sitting at this interface of taking bioinformatics knowledge production and translating it into public health for a public health impact. And what is critical as part of that solution is ensuring the validity of the tools that we produce. And so as you work on your research project, keeping in mind that we don't just run it and get output, but what are the steps we take in order to provide some confidence that the data that was produced by your Python in fact is accurate, is valid. And so that is really where we are at. And so this global alliance has been a great way of international researchers applying their minds to asking what analysis framework should I put in place in order for public health to adopt with a good level of certainty. And so it's all good and well to produce software, and we all do that. The difficulty really is in this statement. Funding mechanisms globally are very risk averse, right? But what they won't do in addition to that is you'll get funds to develop the new method. The funding is far less, it's a bit more difficult to obtain in order to deliver that software to the community, whatever your community is. So if you are in bioinformatics, if you have produced some genotype assay, developing that assay is one thing, but putting that into the field, socializing that amongst the stakeholders for your specific work is the hardest part. And in the Phage Alliance, what we've done is we have managed to secure funding from the Bill and Melinda Gates Foundation to say we develop tools applicable to public health. Let's now partner with public health authorities to understand either the challenges of implementing tools and then refining it, which is part of implementation science, is understanding the gaps, refining what you're doing, going back and testing it again in the lab. And this is what we've been doing. We've had a number of examples where we've taken the analytical tools that were produced within the consortium and have partnered with national public health labs, Nigeria, Malawi, there's examples in Kenya and Malaysia, and then essentially had public health laboratories utilize the tool, feedback the experience, and then in a process of then refining what is being built, putting it back into the lab and seeing whether that works or not. And this has really been I think it's been an exercise, certainly for me. We want to show you that any work that we do that we feel has a translational component. This exercise is critically important in order to ensure the adoption of the tools that we build. And this is giving you a sense as to where we are located, and I'm hoping many of you are joining Phage if you're not part of it already. And so what I really wanted to point out so far is that there's a careful consideration of standards right at the beginning of this value chain in disease surveillance, and that for public health has to influence this entire process. And so there's been all sorts of stuff done along here. I've spoken a bit about this. And really, once we have generated the data, how do we share it? And I must say that something one of my colleagues, Peter, kept on telling me is that we publish data, but are we sharing it? And those are actually two different things, right? I can publish it in a paper, I can publish it in GenBank, but am I sharing it? Do I specifically engage with you? This is the data, let's interrogate it. Can we make sense of it? What is your perspective of that? If I'm in the midst of a disease, what is this data telling you in the midst of a crisis? What can we do in order to limit the spread of a particular pathogen? And so I'm wanting to hone in now in this particular area. And we all know the challenges around sharing data. I'm not going to go into it, but just to remind you, there's a technical one. I think it's probably sometimes the easiest one to overcome. There's a governance issue. How do we deal respectfully with the data that we are grappling with? And there are social things, right? I'm prepared to put my things out there, but come on, man, give me recognition. Right? We want to make sure that there is certainly that attribution that we that we need, and sometimes that need is for promotions, for example. And so how do we deal with this data sharing? And I'm going to just mention two examples. One is taken from Phage, really where we're asking at the governance level, if I develop my bioinformatics applications in the lab, I analyzed, how do we share that? And we've put together a few principles to guide people around maybe what needs to accompany that data as you share it among various stakeholders. It could be shared at a national level, it could be shared. And essentially we have looked at how do we develop certainly a mechanism or even a wording that will allow the mutual respect of utilizing data that is produced by somebody else, setting the stage for a trust relationship, really, out there, in order that we can, in fact, effect a public health response, which is what we're essentially wanting to do. And this work is being led by Nikki Tiffin, who was at Sanby. The other option is there's a governance issue. But just to remind you, with all the equipment that has been mobilized to national facilities during the last 3 years, we're putting into the hands of national laboratories the capability to ramp up their genomic data. And so with increased production of data within country, within our 54, 55 member states, we're really wanting to bring the analytics to the but also we want to make sure that that data that's being produced can be utilized in a environment. And the way that we envisage this is that having some kind of distributed model where pathogens being produced with outbreaks can be rapidly shared across the continent. How do we do that, notwithstanding the infrastructure challenges? So back in 2021, we gathered a technical working group of national public health laboratory folks, as well as bioinformatics people, and really asking what that could meet the needs of countries in the world. So this is really from what we intended. You will submit what this is not saying is how do I deal with my data? How do I see with my colleagues in the Midwest with the outbreak which I have? How do I share it with my colleagues in Senegal today or when or as soon as I have the outbreak? And so what I want you to see here is this over here. Think of your research project. If we're translating research into public health action, look at the cost. Before any complete program, we spent 2.5 years engaging people. And what this is that if we appreciate that knowledge production from the university setting into a public health, that requires careful stakeholder engagement, because without this, the work that we do at universities will not be, because this allows us to develop trust, allows us to understand context. What I'm building as a graduate student sitting in Accra, in Uganda, might have absolutely no bearing on its application in Guinea-Bissau. So it's important that this level of engagement happens. And for us, this was a key factor. So amidst all the need to get data out there, the need to engage stakeholders was critical. And we went through a process of building a prototype. And essentially the idea was whatever that we actually hone in on, are we the correct stewards of that particular information? Do we ensure the accuracy of what we've produced in our respective laboratories? But this is really the crux. We don't produce data for the sake of producing data, right? It is to ensure you're getting this cross-border collaboration and also that you can easily retrieve the data as it is needed. And I think that for me, as I'm moving towards the end of my talk, is to say that in the process of translating our bioinformatics for public health, we have to influence this entire value chain. And unless we can do that, our efforts will remain. And so this really brings me to the last part, which is use case. And I'm not going to go into this, but just to say that there's been quite a process of formulating a roadmap for pathogens which in fact impact our continent. And both academic scientists have been sitting down and considering, so how do we leverage the expertise that has been built up, the technology that has been built up, how do we apply that to these diseases? And essentially, there's a number of stuff that's been underway. And what has been exciting about this is that countries have in fact started putting in place pathogen genomic policies. And once you start to do that, you get the sustainability of the work that we do. I won't go into that. That's another example. But I would like to probably just summarize here and say that I hope that what you have seen is that if we are going to take our knowledge production within the university, and in our context, bioinformatics, if we are going to want to translate that into a public health impact, there are certain stuff that we have to do. And all of the work that we do ultimately will inform a public health decision. There are some exciting stuff which I haven't spoken about. Also, how does AI help us to accelerate this process? But yeah, this is really where we are at in the work that I'm doing and my colleagues are doing and the students are doing, is aimed at how do we assist public health officials to get at a more definitive impact people. And so I definitely encourage you to go and visit my student Chance, her presentation, which is more honing in on the genetic mechanisms of drug resistance. But ultimately, our focus is how do we inform a public health response? And so for you, as you go through your why do I spend the time learning the Python? Why do I spend my to analytics? And how are those things going to impact public health, and it can be in the non-communicable disease space as well? How is what I'm doing have a translation component beyond just the academic exercise? So I'm going to stop there. Thank you.
I'm going to open the floor for questions. Unless I have a question. So, I mentioned that
that last one, how can they adhere to? Because I think the first answer is yes, there are, and I'll give an example. But I think the other part is a shift in what we do, right? So I don't know if you have spoken to people and you ask them, so why do you do it like that? And then the answer is, I've always done it like this. We've always done it like this. So what's the point? So it's a culture change, right? And I think as part of the development work happening, not here, we know that the H3Africa program, even with the H3A Bionet, is how do you effect the change of how people do things? And so in terms of application of there's been a lot of work in the wastewater surveillance, for example, and that has been done. And the challenges are slightly different to some of the other stuff. For the pathogens, the recent work that we did on Ebola, certainly working alongside the group in Uganda, the analytics was there. It is ensuring that the pipelines that you run can be run tomorrow the same way as what you were doing it today. With all to install the software from a Docker container, for example, that certainly verifies that all the dependencies are well packaged. We then also ensure that as that is being run, that the data that's coming from that can be shared appropriately within the context of where that particular outbreak is happening.
Just like what the guidelines
So yes, so there was a bit of a statement and a question in that, the idea of having an independent authority validate. And so this is what we're grappling with here. What does it take to validate both the wet lab laboratory as well as the bioinformatics? Well, I can first tell you what's happening on the ground. I have a friend who runs a about 45 kilometers. She uses to ensure lab adheres to criteria that in terms of standard. Come on, who of you are going to use your life? Barrier to entry for many laboratories is that it is just too expensive to ensure that. So, if that is the barrier, is there a possibility to think of a process by which we become ready for it? And the notion of accreditation ready, right? And so while we would get an external authority to rubber stamp what's being done, in the absence of the resources to do that, do I tell myself, how do I ensure that I am accreditation ready? How do I ensure that my pipelines have followed all the best practices to be ready when somebody does validate them? In the context of bioinformatics, it's been very that that your international bodies like ISBA has included an ISO level of accreditation for bioinformatics. And that includes stuff like ensuring that the computer for your colleague down the corridor who would like to do some SNP analysis for the plant genome cannot touch that machine. That's a So I think what I'm really canvassing for is, in the action of resources, to ensure that type of balance. What is our responsibility in making our methodologies certainly validation ready. And I think that for me is the key, because I don't see us getting that level of external authority on every pipeline which we do, because as you know, tomorrow you discover that, actually, this is, can I maybe try and modify this, put in place the correct checks and balances, and then offer that as an alternative. And so that is really my position on external validation. We see a lot of it happening with the EQA programs, for example. Those are not sustainable. That's the reality. So, okay, so there are a couple of things here, I think, around data sharing. You've also raised the question around national rules that guide that. And so I think a few points there. The one is data ownership versus data custodianship, right? So data that's being generated in a country will have to abide by the laws that to that particular environment. So if you look at the data policy framework on the African continent, are promising 12 maximum, and those are evolving states. So the next question would be, how do we become data custodians? How do I respectfully manage the data that I have, because either produced by my colleague down in the corridor or by somebody else in the client? And so the reality is that whether we like it or not, packaging data comes with a huge risk as well. And so you probably don't have an option in terms of the packaging industry. And so I like the definition, which I heard about 2 years ago now, as open as possible, as closed as possible. And what that means is that clinical data, you can stand on your head with clinical data will go nowhere. And the reality is that there is a risk to the patient. So no matter how much you open data framework, clinical data is inherently challenging because there's so much that can go wrong. And that's why the idea of as close as it is. When I get to this, when I have the data I need to share, the principles has to come out. What am I allowed to do with it? You mentioned the popular Africa, and there are many other countries that are doing it. What does it mean for us in bioinformatics? That the data has to be analyzed in country. So if your country has data protection laws and you are busy analyzing data, if you need some cloud computing, you are going to have to guarantee that that's in your country. I suspect that we're going to move to a space over time where I could be sitting in country X who doesn't have a job. But I see close by maybe that's going to lead people to say, well, in my economic zone that I would allow the data to be crunched on the machine. And I think we're going to get to that point where the guiding principle is going to be what is And for the cloud computing, what has been a real eye-opener for me is that the shared responsibility model of cloud providers. So you want to share your data, we'll put it on we will put it on the Amazon cloud. Amazon cloud guarantees security of the cloud. It ensures that the cloud is secure, the critical equipment is secure. It doesn't guarantee security in the cloud. That's your responsibility, that's my responsibility as the data custodian. And so, as your question, if you think about what is allowed and what is not allowed, I think that the nuance also is really that there's going to be a move that at the national level, they'll seek on strict control of what's happening. There's going to be at the level of you as a researcher, things that you've got to put in place, basic mechanisms you've got to put in place. I think that's really, really going to happen. In the context of continental pathogens, I think it's exciting to see that the African CDC has been certainly negotiating with countries on how does the African Center for Disease Control become custodian of pathogen data that's produced as a way of facilitating the exchange of data. You might be country X, you country Y. I might not trust you, but I'm trusting another continental body. So if we both are power into that body, yeah, we make us strong. And that's some of the examples unraveling of